Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSSB नर्सिंग ऑफिसर एग्जाम द 28 ऑफ अगस्त 2019 शिफ्ट सेकंड का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 51. Which of the following is a classic presenting symptom of retinoblastoma? A. Brushfield spots. B. Brudzinski's sign. C. Cat's eye reflex. D. Reed-Sternberg cells. Correct answer C. Cat's eye reflex. 52. What is the Billroth-II procedure? A. Subtotal gastric resection with gastroduodenostomy anastomosis. B. Subtotal gastric resection with gastrojejunostomy anastomosis. C. Duodenojejunal bypass with sleeve gastrectomy. D. Total gastrectomy with esophagojejunostomy anastomosis. Correct answer B. Subtotal gastric resection with gastrojejunostomy anastomosis. 53. What is the ideal time to perform chest physiotherapy? A. 30 minutes before meals and 1 to 3 hours after meals. B. 1 hour before meals and 1 to 3 hours after meals. C. 30 minutes before meals and 30 minutes after meals. D. 1 hour before meals and 30 minutes after meals. Correct answer B. 1 hour before meals and 1 to 3 hours after meals. 51. What is the use of a cystometrogram? A. Measures the urine volume in a single voiding. B. Evaluates the bladder tone and sensation of filling. C. Records electrical activity within the muscles. D. Evaluates the structure, function and effusion of a kidney. Correct answer B. Evaluates the bladder tone and sensation of filling. 55. For which of the following conditions can a child be advised ketogenic diet therapy? A. Seizures. B. Encephalitis. C. Guillain-Barré syndrome. D. Cerebral palsy. Correct answer A. Seizures. 56. Who introduced the staining technique? A. Louis Pasteur. B. Paul Ehrlich. C. Watson and Crick. D. Robert Koch. Correct answer D. Robert Koch. 57. Mr. X's blood glucose level is 250 mg per deciliter and he has ketones in his urine. What advice should a nurse give him about exercising? A. Exercise once a week. B. Do not exercise. C. Exercise 1 to 3 times a week. D. Brisk walking at the same time every day. Correct answer B. Do not exercise. 58. A nurse is caring for a patient following an endotracheal extubation. Which of the following is not a nursing care aspect in this case? A. Give oxygen by a face mask. B. Monitor respiratory rate in chest excursions. C. Do not provide mouth care to prevent bleeding. D. Do not give anything orally, NPO. Correct answer C. Do not provide mouth care to prevent bleeding. Unsert. Identify an immunoglobulin present in milk, saliva and tears. A. IgG. B. IgM. C. IgA. D. IgA. Correct answer C. IgA. SART. People of which descent are more commonly affected with thalassemia? A. Red Indian descent. B. Caucasian descent. C. Mediterranean descent. D. Mexican descent. Correct answer C. Mediterranean descent. Excerpt. The MTP Act recommends termination of pregnancy by a single doctor when the pregnancy does not exceed A. 12 weeks. B. 14 weeks. C. 16 weeks. D. 20 weeks. Correct answer A. 12 weeks. Bassett. The committee which was appointed in 1974 by the Government of India, under the Ministry of Health and Family Planning, for medical education and supporting manpower is known as DA. A. Mudaliar Committee. B. Chadha Committee. C. Mukherjee Committee. D. Srivastav Committee. Correct answer D. Srivastav Committee. Tirsat. Identify a microvascular complication of diabetes mellitus from the following. A. Stroke. B. Peripheral vascular atherosclerosis. C. Nephropathy. D. Coronary atherosclerosis. Correct answer C. Nephropathy. Chaussat. Identify a degenerative disorder characterized by disseminated demyelination of nerve fibers of the brain and spinal cord. A. Muscular dystrophy. B. Multiple sclerosis. C. Myasthenia gravis. D. Alzheimer's disease. Correct answer B. Multiple sclerosis. PESAT. Which test is used to check the collateral circulation to the hand? A. Romberg's test. B. Shamroth's test. C. Capillary refill test. D. Allen test. Correct answer D. Allen test. Chiasat. The process of movement of individuals or groups from one stratum to another is called A. Social organization. B. Social stratification. C. Social change. D. Social mobility. Correct answer D. Social mobility. Sarsat. Administration of immunoglobulin as an example of A. Active natural immunity. B. Active acquired immunity. C. Passive natural immunity. D. Passive acquired immunity. Correct answer D. Passive acquired immunity. Arsat. The drug used in XDR tuberculosis is A. Streptomycin, B. Sapromycin, C. Rifampicin, D. Ethambutol. Correct answer B. Sapromycin. 69. A person with possibacillary leprosy has A. 1 to 5 skin lesions with no nerve involvement, B. More than 5 lesions with multiple nerve involvement, C. 1 to 5 skin lesions with single nerve involvement, D. More than 5 lesions with single nerve involvement. Correct answer C. 1 to 5 skin lesions with single nerve involvement. 70. According to Sigmund Freud, which of the following options functions on the basis of the reality principle? A. Apathy, B. Id, C. Superego, D. Ego. Correct answer D. Ego. 71. Primary prevention aims to reduce the A. Number of cases of a disease, B. Complication of a disease, C. Prevalence of a disease, D. Incidence of a disease. Correct answer D. Incidence of a disease. 72. Which of the following characteristics is not true of a primary group? A. Formal rules, B. Small size, C. Direct cooperation, D. Unity. Correct answer A. Formal rules. 73. The recommended period for isolation for measles is A. From onset of the catarrhal stage till 3rd day of the rash, B. From onset of the catarrhal stage till 10th day of the rash, C. 3 weeks after onset of the disease, D. From onset of the catarrhal stage till 7th day of the rash. Correct answer A. From onset of the catarrhal stage till 3rd day of the rash. 74. An outbreak of disease in bird population is known as A. Aponethic, B. Epizootic, C. Exotic, D. Enzootic. Correct answer A. Aponethic. 75. What is the duration of the fibroblastic phase in wound healing? A. 3 days to 3 weeks, B. 5 days to 3 weeks, C. 1 day to 4 weeks, D. 4 days to 1 week. Correct answer B. 5 days to 3 weeks. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।